Now remember that in addition to the face, 85% of your female patients have cellulite, and for that we have the Sunekos Cell, which inside, in addition to the key amino acids and low-weight hyaluronic acid which you find in this vial, 10 ml, it has carbonate and bicarbonate in this vial of 5 ml. Now when you mix the 10 with the 5, you will get 15 ml targeting the fluid retention, the vascular dysfunction, the acidic pH, the inflammation, the fibrosis, everything that's medically really related to the cellulite. So this is a very medical approach, not just aesthetic approach to a very chronic condition that so many of your patients are fighting with. We're going to be injecting Sunekos Cell. We can do it with a needle or with a cannula, but as we try to be as little aggressive as possible, I prefer the cannula. And we are right subdermal with the cannula, and we start slowly injecting. Totally different from what we thought before, when we're going really in an aggressive way, dissecting whatever we thought were pulling collagen fibers. Now we know that cellulite is already a condition where inflammation is present, so we really do not want to have more inflammation coming to the tissue. On the opposite, we want the key amino acids inside the Sunekos Cell to fight inflammation, to fight the lack of blood supply to the tissue, to regain homeostasis of the whole extracellular matrix, which are the real conditions that are involved with this chronic pathology, and this is the correct medical way to have a good approach at it. And we shall be doing the rest for the remaining points. Now, if you want to do it with a needle, which is also a very easy injection, you can take the 13 gauge needle. If you want to do it with a needle, you take the 13 millimeters 30 gauge needle and you go 45 degrees angulation, half needle in, and you deposit the product around 0.1 in each of the points. But as I was telling you, I really prefer to do it with a cannula because there is much less trauma for the tissue, and that is a big aim that now we are aware in cellulite, but we're not aware of that before. What is very important in cellulite is to be as gentle as possible and cover the whole area, because then the product will give you remodeling of the skin quality, but also very targeted action like antifibrotic, anti-inflammatory, antioxidant, so whole regeneration of the skin and of the whole extracellular matrix. As we were mentioning, by this approach we are targeting not only the skin's health, but we are really having an antifibrotic, anti-inflammatory, anti-fluid retention effect, which is really the deep down mechanism that causes our cellulite to be so unpleasant, aesthetically talking.